Hello, sir. How are you today? My name is Dr. Jonathan Ruterbories, and I am going to be your pulmonologist today. I see that you were referred by Dr. Anit Barrera, which is awesome. Great guy. He was actually my TA in college, in a college class I had. And he's referred me to you because he suspects COPD. He's referred me to you so I can confirm it. Now, the way I'm going to do that is, do you remember just a few minutes ago or a few days ago when you came in for a quick test, and we ran a test called spirometry. And what happens in spirometry is you blew into a tube, and the object on the other end of that tube actually measured the amount of airflow in your lungs, the amount of air in your lungs. And less air means we can diagnose you with COPD based on the level of measurement that was taken by that spirometer, which is the object at the other end of that tube. So when you came in for that test a couple days ago, that's what we were looking for, and we were really testing for the amount of air that your lungs can hold. So talking about COPD, chronic obstructive pulmonary disease, is actually a 1-2 punch disease. 1-2 punch meaning two diseases present. Now, those two diseases are emphysema and bronchitis. Now, not the bronchitis that you had as a kid, although working very much the same way. It is chronic bronchitis, so it is long-lasting and is with you forever, which is hard it's a hard fact to accept, but in the end, will help treat you with symptoms you won't even know. Treat your symptoms you won't even know it's there. So that's a little bit about chronic obstructive pulmonary disease, and the way that's the definition of it, and the way that 1-2 punch works is if you see these bronchial tubes right here, which are these things right here going throughout the lungs. I don't know if you can tell, but these are lungs. The way this works is bronchitis actually is an inflammation of the lining of the bronchial tubes. So right here, where your bronchial tubes are, which are these little tree things coming off into the lungs right here, the inside lining of those actually get inflamed, which, as you can tell, creates less space so that not as much air can flow through. So it's the same concept that if you have a big barrel full of water and you fill it up, if you build onto the inside of those walls and create a smaller space, it's going to hold less water. Well, same thing here. Your bronchial tubes, as they inflame, they'll hold less air. In the second, so that's the first punch of this 1-2 punch. In the second punch, if you look at the very end here, you'll see all these little red dots that I'm drawing, and those are actually what we call alveoli. And those alveoli are little air sacs on the end of your bronchial tubes, and there are actually about 300 million of them in your entire lung, and that's lungs, and that's crazy. That's a huge amount, right? So those 300 million sacs of air, which we call alveoli, actually filter out once the air gets to through the bronchial tubes to the end of them and enters your alveoli. They actually expand and filter out the carbon dioxide, the stuff we don't need, the stuff we don't want in our body, right? And then we get the oxygen through the alveoli and is transferred to the rest of the body through the blood. So that's what the alveoli does. Now, we talked about bronchitis inflaming the lining of the bronchial tubes. Now, emphysema is actually destroying these alveoli. Now, as you can imagine, simple law right here, action-reaction. If you are destroying these alveoli, which emphysema is doing, and you have less of them, it's going to be much harder for oxygen to transfer throughout the body and into the blood because it's not able to meet with the demands of the body in terms of oxygen. So it's not able to take as much oxygen and spread that to the rest of the body if you have less of them. And also too, with less air getting through the bronchial tubes, your alveoli cannot expand as much, which is very hard for the alveoli because it's still trying to meet those needs of the body. And so if you have that 1-2 punch, you have less of them and you're not getting as much air, then definitely not enough oxygen can get to the rest of the body, and it can really create problems for your body and really make it hard on you. And so that is what COPD does, and it's a very tough disease to handle, but I believe we can do it for you today. So the way the progression of chronic obstructive pulmonary disease works is you actually start presenting with decreased lung function. And now, early on, actually 12 million Americans suffer from COPD every year, and 12 million Americans actually don't know they have it because no one ever catches these early on presenting symptoms. And this is the case with you today, sir, is we didn't catch those early on presenting symptoms, and then once you really started getting shortness of breath, maybe cyanosis, which is the blue discoloration in your fingernails and maybe on your lips, once those symptoms started presenting, we said, oh, hey, wait a minute, you might have COPD. So then you get sent to me, and we do confirm that you have COPD, and it's unfortunately sort of in the ongoing stages. So after that no early diagnosis is found, once we do diagnose you, the way it goes if untreated, lung function will continue to decrease steadily so much that even putting on your clothes will be hard and make you short of breath, and even walking upstairs, it'll just be awful. It'll be so strenuous and terrible for the body because the amount of oxygen you need to do these tasks will not be able to get to those parts of the body because not enough air is getting through the bronchial tubes and into the alveoli. So that's a little bit about the progression. Now, in terms of treatment, now the good news is we cannot reverse COPD. The effects have happened. We cannot reverse it, but we can treat the symptoms that you are having now. And the good news with you, sir, is that it's not so far along that we can't even treat the symptoms and then you're just going to be miserable even if we do treat the symptoms. The case with you is that we can treat the symptoms and you can live a pretty normal functioning life. You can go upstairs, you can get yourself dressed, and we can get you to a place where we can meet your physical activity based on the oxygen that's getting in your lungs, meet those needs of your body. And that's really good. That's a really good thing for you, sir. So the good news is, while irreversible, there's a good outlook. And you know, as long as you comply with treatment and you stop smoking, which I'll talk about in a second, you have a pretty good outlook, prognosis here, which is awesome. So first line of treatment, smoking cessation. Stop smoking. You got to do it. It is very important that you stop smoking. There is no other option. If you do not stop smoking, we cannot treat COPD effectively, and you will not live much longer, sir. Very important. I know you've been a lifetime smoker, but we are here to help. We will refer you to any nicotine supplements, anything like that, to sort of take the place of your fix of cigarettes, but it has to stop. No more smoking. And I am serious about this. No more smoking. Smoking cessation, first line of treatment. Now, the second line of treatment we have today is what we call a bronchodilator. So I have here, usually comes in inhaler form, much like this, like Prevental, which is what this is. We'll prescribe you a bronchodilator. Now, what these do, dilate to mean expand. So a bronchodilator will actually take, you will inhale it through the inhaler, and then it will actually take the lining of your bronchial tubes and actually relax the inflammation, decrease the inflammation, so it's a little bit less and opens up a little more space for air to get through, therefore helping your body meet these oxygen needs and helping the blood flow increase to the rest of your body, meeting these oxygen needs. So the way you're going to administer this, brought an example for you today, is you're going to take it, you're going to insert it, put your lips around the end of the tube, and you're going to push this little button right here. So you're just going to push down on it like that. And you're going to take it, put your lips around the end, and once you push down, you're going to suck in the air into your mouth, and you're going to inhale it. Now, you're not just going to keep it in your mouth, blow it out. You're not just going to, swallow it like you're drinking water. You're actually going to inhale it into your lungs, so you're going to breathe in deeply and make sure that gets into your lungs so that it can open up these bronchial tubes. So just as an example here, you're going to take it, lips around the end, and inhale it right into your lungs. Works very fast. It'll decrease the inflammation in your bronchial tubes, and it'll help you live a normal, healthy, further life, even though you're suffering from COPD. It is treatable, and that is the good news. First step, quit smoking. Second step, bronchodilator. See me again. We'll follow up in a few months, see where you are, and see if we need to do anything extra for treatment, okay? All right, have a good day, sir, and tell Dr. Barrera I said hi.